Hello and welcome to my presentation about the anatomy ultrasound for primary care in childbearing women. What is an anatomy ultrasound? It is the utilization of sound waves to assess the baby's anatomy. It is important to note that ionizing radiation is not used. It occurs in the second trimester of pregnancy around 18 to 22 weeks. It is an overall survey of the fetal anatomy and provides an estimation of the gestational age of the fetus. This ultrasound will look at many anatomical components of the baby, amniotic fluid, as well as the placental placement. Recommendations for this test by the American College of Obstetricians and Gynecologists Committee say that an ultrasound is not associated with risk to the mother or the baby, but the decision is ultimately up to the pregnant patient. The provider should use their discretion and only order an ultrasound if it provides medical benefits to the patient, although it must be said that most women in their second trimester do complete a fetal ultrasound for anatomy. Is this test accurate? Specificity and sensitivity. All women should be offered a genetic screening ultrasound to assess for fetal abnormalities at this time. Although the accuracy and rate of detection of fetal abnormalities varies from 44 to 89%. This is a huge range, and we must acknowledge that all fetal abnormalities are not seen on this ultrasound or are accurately diagnosed. Indications for this test is that it is a useful diagnostic tool to gauge the progression of the pregnancy and the development of the baby. Early diagnosis of genetic abnormalities can be seen, and early intervention to the diagnosed abnormalities can be addressed. Contraindications. There aren't many contraindications for the anatomy ultrasound, as these machines use a lower temperature, thus providing no risk to the fetus or the mother. There are very few potential risks if it's not used properly, so an ultrasound should only be given when it's clinically needed and relevant. Procedure of the test. It is conducted via transabdominal or transvaginal ultrasound. It is utilized with a transducer, and if it's given via the abdomen, a lubricating jelly is applied and moved across the abdomen. If it's transvaginal ultrasound, the transducer is placed in the vagina and is also lubricated. 2 hours prior to the exam, the patient is asked to drink several glasses of water to make the bladder full. A full bladder creates a window, allowing the technician to see the baby, placenta, and umbilical cord more easily. Advantages and disadvantages of this test. It can definitely provide a mother peace of mind. Knowledge is power, so if there is something that is seen on this ultrasound, the provider and the patient can work together to understand what is going on and how to address it, which leads me to my next point of early diagnosis and then early intervention. The disadvantages is the stress of possibly knowing that something is wrong and then causing even more anxiety throughout the rest of a woman's pregnancy. Incidental findings that can worry the mother but are no harm to the baby. We'll address those a little bit later. An improper diagnosis given could also be a disadvantage of this test. Normal findings. Normal findings are all listed here. All in terms of the anatomy, you want to see the head and the neck of the baby. It's important to see lateral cerebral ventricles, 2 of the 4 ventricles of the brain. In the chest, the 4-chamber view of the heart is seen. A heart rate is taken, and it ensures that the diaphragm is intact. They also look closely at the left and right ventricle outflow. Within the abdomen, the measurements of the stomach are seen, and then the intactness is addressed. And they look for the presence of the kidneys, bladder, and umbilical cord, and they examine the number of vessels in the umbilical cord. The spine is looked at closely, which includes the cervical, thoracic, lumbar, and sacral. The skin has to be examined there as well to make sure it's covering the spine in its entirety. The extremities are looked at for 12 long bones, including hands, legs, and feet. Genitalia are looked at, so as the sex can be determined at this ultrasound, and the placenta is looked at with the measurement of the placenta is noted in relation to the cervix. Abnormal findings. Abnormal findings or soft markers are standard findings in a second trimester anatomy ultrasound, and they are greater in frequency in association of implody or Down syndrome especially. Soft markers were first identified in the 1980s, and they are further evaluated using the likelihood ratio. This ratio provides an assessment of how likely the baby has the condition compared to those who don't. Soft markers do not signal increased risk. Soft markers do signal increased risk, but are not diagnostic. Abnormal findings are listed here. We can start with the brain and skull. Ventriculomegaly, which is the enlargement of the ventricles in the brain, mild or not, can be associated with abnormal neurodevelopment. This is very high risk. An expert ultrasound will be needed in order to review the initial ultrasound, and the mother will be suggested that she pursue fetal karyotyping and have close follow-up. Other abnormal findings include a large Cisterno Magna, which is a focal enlargement of the cerebral spinal fluid filled in the subarachnoid space in the inferior and posterior portions of the cranial fascia. This is a low risk when seen alone on ultrasound, but when seen in combination with other soft markers could be an indication that there is something indeed wrong. On the face, a cleft lip can be seen. This is an abnormality that isn't addressed until after the baby is born, in which case they can address it then. The neck, if there's a thick nuchal fold or nuchal mass, this can be associated with the fetal aneuploidy, which is the presence of one or more extra chromosomes or the absence of one or more chromosomes. This could also be an indication of single gene disorders and congenital infections. This is very high risk. An expert ultrasound has to then be completed and reviewed, and then the mother will be suggested to go through fetal karyotyping and close follow-up. Within the chest, an abnormality seen is a hernia to the diaphragm or a large chest mass or pleural effusion. This just requires close monitoring and follow-up, and then possible intervention when baby is born, if medically appropriate. More abnormal findings included in the heart is a large ventricular septal defect. Baby will have to be closely monitored when they're born, and an intervention should take place sometime within the baby's life, or the baby has higher chance of heart failure, stroke, and pulmonary hypertension. Other abnormal findings is an echogenic cardiac focus, which is a bright spot seen on baby's heart. This is an example of a finding that could worry a mother, but really is just something small when seen on ultrasound, because most babies who have echogenic cardiac focus seen on ultrasound are healthy. They just have to be monitored. Arrhythmias can be seen as well, and that has to be continue to be monitored throughout the pregnancy and when the baby is born. Within the abdomen, an echogenic bladder, a bright bladder on ultrasound, which lights up, is associated with fetal aneuploidy, cystic fibrosis, congenital defects, and structural bowel defects. So this bright spot of indication within the bladder is far riskier and indicative of something higher risk than when it's seen light up within the heart. And when it's high risk, it is graded on a scale of 1, 2, or 3, and grades 2 to 3 need further workup. Abnormal findings continued in the genitourinary tract. Mild renal pelvic dilation can be associated with congenital hydronephrosis and fetal aneuploidy. Another low risk when seen alone on ultrasound. However, if it's seen in combination with other soft markers, could be indicative of something more and will require follow-up. The spina bifida can be seen at this time, And there is no cure for spina bifida. It really depends on if it's mild, depending on the different types of spina bifida. The options will then have to be discussed with the mother. Extremities, shortened humerus or femur can be seen at this time as well, and it is associated with fetal aneuploidy. This is a very high risk when it's seen on the ultrasound. Definitely could be indicative of an extra chromosome or loss of a chromosome. And then fractures and bowing with in the baby can be seen as well, and intervention and follow-up is pursued once the baby is born. Client teaching and counseling. Effective communication is key. If there is anything seen abnormal within the ultrasound, a face-to-face communication needs to happen between you and the patient. And if everything looks completely normal, this has to be communicated to the patient as well. There is always a level of anxiety occurring at this stage, and peace of mind is everything. So if they can be provided that, it has to be offered. But if there is something wrong, we have to be sympathetic and understanding to our patient's anxiety around normal or abnormal ultrasound results, and a plan of care needs to be made with them and pursued. These are my references that I used for this presentation. Thank you so much for watching.